Hello, I'd like to share some information with you today in regards to post-traumatic stress disorder. This information is coming from the National Institute of Mental Health. Their website is www.nimh.nih.gov. So, what is post-traumatic stress disorder? Some people develop post-traumatic stress disorder, PTSD, after experiencing a shocking, scary, or dangerous event. It is natural to feel afraid during and after a traumatic situation. Fear is part of the body's normal fight or flight response, which helps us develop or respond to potential danger. People may experience a range of reactions after trauma, and most will recover from their symptoms over time. Those who continue to experience symptoms may be diagnosed with PTSD. So, who develops PTSD? Anyone, any person can develop PTSD at any age. People who have been diagnosed with PTSD may feel stressed or frightened even when they're no longer in danger. Not everyone with PTSD has gone through a dangerous event, though. Keep in mind that in some cases, learning that a relative or close friend's experience with trauma can also cause PTSD. So certain aspect of trauma or a traumatic event and some biological factors such as genes may have some people more likely to develop PTSD. So what are the symptoms of post-traumatic stress disorder? Symptoms of PTSD usually begin within 3 months of a traumatic incident, but they sometimes can emerge later. To meet the criteria for PTSD, symptoms must last longer than 1 month, and they must be severe enough to interfere with aspects of daily living, such as relationships, work, etc. The symptoms also must be unrelated to medication, substance use, and/or illness. So, the illness or the diagnosis may vary, although some people recover within 6 months. Others have symptoms that last for a year and or longer. So individuals with PTSD diagnosis often have reoccurring or co-occurring conditions, such as depression, substance use, or more other anxiety disorders. So after an event, it is natural to have some symptoms or even feel detached from the experience, as though you're observing things rather than experiencing them. A healthcare provider, such as a psychiatrist, a psychologist, a clinical social worker, a licensed certified counselor, who has experience with helping individuals with diagnoses of mental health, can determine whether or not the symptoms meet the criteria for post-traumatic stress disorder. So what's the reason that some people develop PTSD and other people do not? Well, not everyone who lives through or has experienced a dangerous event will develop and or be diagnosed with PTSD. Many factors play a part. Some of these factors are present before the trauma. Others become important during and after the traumatic event. So there are risk factors. So risk factors that may increase the likelihood of developing PTSD can include, but not mutually exclusive, exposure to dangerous events and or traumas, getting hurt or seeing people hurt, childhood trauma, feeling horror, hopelessness, extreme fear, dealing with, extra stress after an event, such as the loss of a loved one, pain and injury, loss of a home, of a job, also having a personal history or family history of mental illness and or substance use. There are also resiliency factors. So some of those may be seeking the support from friends and family or supportive groups, keeping in mind social distancing due to COVID, though, in regards to the support groups. Learning to feel okay with one's actions in response to a traumatic event. having a coping strategy for getting through and learning from the traumatic event, and being prepared and able to respond to upsetting events as they occur despite feeling fear, aka identifying your triggers as well as identifying coping skills and practicing those. And that can be useful and worked through and on with a mental health provider. So, how is PTSD treated? It is important for any person with any type of PTSD symptoms to work with a mental health professional who has experience in treating PTSD. So the main treatments are psychotherapy, medications, and or both. An experienced mental health provider can help an individual find the treatment plan that meets the person's needs as well as their symptoms. Some people with PTSD may be living through an ongoing trauma, such as an abusive relationship. In cases such as those, treatment can be most effective when it's addressed both the traumatic situations as well as the symptoms. So individuals who have PTSD or diagnosed with PTSD or are exposed to trauma also may experience panic disorders, depression, substance usage, ideation, thoughts. Treatment for conditions such as those can help with recovery with trauma and after trauma. So for tips on how to prepare and guide you on how to talk with a mental health provider about your symptoms, please, I encourage you to visit NIMH's fact sheets under Taking Control of Your Mental Health, tips for taking or talking with your healthcare provider. So in regards to psychotherapy, sometimes individuals may call it kind of talk therapy. That includes a variety of treatment techniques that us mental health providers, professionals utilize to assist individuals in identifying and changing troubling emotions, thoughts, behaviors. Psychotherapy can provide support, education, and guidance, suggestions, if you will, to individuals that may be suffering or diagnosed with PTSD and their families. So, the types of psychotherapy target PTSD symptoms, and others can focus on social, family, or job-related concerns and issues. So what can a person do to support themselves? It's important to know that although it may take some time, things can get better with treatment with a mental health provider. So some things that you can do to help yourself is talk to a mental health provider about treatment options and follow those plans, engaging in exercise, mindfulness, and or other activities to assist in reducing stress. Try to maintain routines for, meals, exercising, sleep, setting realistic goals, and do what you are able to do. Spending time with trusted friends, relatives, and also expect that your symptoms may improve gradually and may not happen immediately. Also, avoiding the use of alcohol and drug use. So I hope that this information was of assistance for you, and I hope that you enjoy the remainder of your day.